Thank you very much for looking into the future as general community health initiative and being managed by you, the younger people, because the younger surgeons of today are the futures of tomorrow, and the mentorship that you're doing, it will be like the watering of the gardens to make sure that actually the young surgeons grow more. But I want to look at the vision to build healthy, resilient, and empowered communities where every person, regardless of location or socioeconomic status, has equitable access to quality, preventive, diagnostic, therapeutic, and referral services for non-communicable and surgically amenable illness. This speaks a lot to the reasons as to why some of my deliverables at community of quality of care we are doing. We want to get people to access surgical services and other related services at an affordable or no cost, but also in timely and safe with complication-free outcomes. And that should be our aim. So if you are working in that aim and that big vision, then you have already started giving me the answers to why I was given the responsibility. But also, I want to allude to the mission. That's the way how things will be done to achieve the other vision we have. To improve community health outcomes through accessible, community-centered health programs that promote awareness, prevention, screening, treatment, and referral for non-communicable diseases and surgically amenable illnesses, focusing on the hypertension, diabetes, and triple cancer burden of prostate, breast, and cervical cancer among rural and undeserved populations. Maybe the broad spectrum there, we could increase others. A number of malignancies, and then a number of neglected diseases, including surgery, as surgery is termed as one of the neglected, because sometimes we don't have people who can take us through a surgical venture that is good. Now, I also want to look at the things you do, and I see there is community clinics, and this is the way to go. You may not necessarily run fixed clinics alone, but we need to devise means by running mobile health services, especially in rural communities. We still have that inaccessibility to health services. Why? Because people traverse so many kilometers to access services. So if you can go out and you deliver a service within the communities or the vicinity of patients, this will go a long way to make sure that actually we spread the gospel of service delivery. And if you look at the cancer care program, you have realized that actually we are decentralizing some of the services. And in Igulu, there's already a cancer unit, Marara, and I think in Mbale. So Cancer Institute is doing that. So if we can also, in one of my mandates to work with different institutions, then it means that you want to start a service that you may need actually to get hands-on from already a center of excellence which is available, and even to your close area like Lacho is providing some of those services. So we may need to promote the private public partnerships, but also look out for partners within the communities where we stay to make sure that we deliver such services. And then when it comes to injury care, you know that actually trauma, and you have seen me several times working with ASAO about trauma. Trauma is one of the second or third leading cause of morbidity and mortality in Uganda, following other conditions. And to let you know that actually we have a responsibility that actually, apart from identifying, screening, and triaging, and managing, we also need to do mentorships so that we get people who can provide care. And I'm looking at a number of things. Trauma. Suppose a patient is polytrauma, that he has head injury, chest injury, abdominal, and then the extremities. Those are lower limbs, upper limbs. Can we get a surgeon, or can we get a team of surgeons? Maybe one medical officer that we have skilled so that he can open the cranium, either craniotomy or overhaul. He can do something on the chest, either putting a chest tube or doing a mini thoracotomy, but also be able to open the abdomen, a lap, and assess and even fix the lower limbs. So that at the end, even when this patient is not managed up to the end, but they refer at the right time. I think this also speaks volumes to the responsibility that I have, and you are most welcome on board so that we can work together. And then to the last one, Jane Institute for Global Health Equity. Please, as I discussed with you earlier, Dr. Senun is a very good, nice man. We didn't know each other until some of these platforms, like the Sogai, brought us together. He made so many presentations, and wherever I was on Sogai Forum, I could chop whatever I'm doing and listen in, and he was speaking to what we want. So I want to say that let us continue advocating for global health equity, because we have asked ourselves, if I fell sick, Kabweru, can the government support me? We have seen our colleagues fall sick. I don't know. Whereas if the politicians fall sick, they have insurance. For us, the provider, we don't have. So can we, and also if me, I cannot afford, what about somebody who is in Ajuman there? Somebody who is in Kalisizo? Someone who is in Kabari down there in the village? Someone who is in Karamoja deep there? Or Amdat? Someone who is even in Ruwero here deep. You know, Ruwero, you may think is central, but when we do some assessment, you realize that we need a lot of these initiatives. So I'm going to say, let us work as a team. And I want to encourage you, please teach both faculty and teach the younger ones, and we teach each other, and we secure each other, and we move as a team. So with those, if I say, you said you have already 6-7 mentees. I was saying that recruit me and we work as a team. And I want to say that thank you very much. And with my singular honor as the Chief Surgeon of Uganda, I want to say that I declare this Global Surgical North Star Mentorship Program 2026 open, and we want to wish you the best as we mentor each other for God and my country. Service with honor. Thank you very much, and I wish you the best in the endeavors as we work and mentor each other in this line.